Everyone. My name is Rebecca Guterman, and today I'll be talking to you about taking care of you with nutrition during and after anal cancer treatment. I have no disclosures, and the products that I might mention today throughout my talk are my personal recommendations and not endorsed by the Anal Cancer Foundation. So today I will be reviewing nutrition during and after chemoradiation cancer treatment, discussing symptom management, and discussing goals for nutritional intake and weight management, including healthy nutrition guidelines. So during treatment, diarrhea and pain when having a bowel movement are very common symptoms. Eating a low fiber diet that includes easy to digest foods is recommended to follow during this time. This includes refined grain products such as white bread, white rice, rice cereals, peeled fruits, cooked vegetables until they're soft, and foods such as apples, applesauce, bananas, and rice, as these are known to help bind the stool. You also want to avoid acidic or spicy foods, such as citrus fruits, like oranges or grapefruits, tomato sauce, hot peppers, pineapple, alcohol, coffee, or caffeinated beverages. You want to make sure you stay hydrated. So I recommend low sugar electrolyte beverages such as Noon Sport or Drip Drop. They come in tablets or powders that could be added to water to help you stay hydrated. It's also important to aim to maintain a good nutritional status if you're feeling well during treatment. You want to make sure that you're eating healthfully. You also want to make sure that you're eating to prevent unintentional weight loss. Eating 5 or 6 small meals daily helps with this goal, as they're usually easier to eat than 2 or 3 large meals. You also want to include healthy, higher calorie foods if you're struggling to eat. This would include avocados, any type of nut butter like peanut butter, any type of nut or seed. If diarrhea or bowel movement urgency persists throughout treatment, one recommendation is to add soluble fiber. This would be through using a fiber powder. So something like Metamucil or Citracel, where you use 1 teaspoon and you add it in 2 ounces of fluid. You mix it until it dissolves. You do not want to drink extra fluid with this dose because it works the best with this small amount of water. The brand Metamucil also makes fiber thins, which are like a cracker, and you could eat them instead of having to dissolve the powder, but you also want to make sure that you're doing so with a very minimal amount of water. This is because soluble fiber can help absorb some extra water in your colon, so limiting your fluid after you take the dose would be beneficial in helping to slow down diarrhea. Applesauce, bananas, banana flakes, and marshmallows have also been shown to be helpful with diarrhea. You also want to avoid simple sugars. These are foods that are very high in sugar, such as any type of fruit juice, honey, soda, or desserts. Chewing is the first step in digestion, so you want to make sure that you chew your food very well while you're eating to help it break down before it even reaches your stomach. You also want to talk to your doctor about medication, not only taking them, but when to take them, as timing could play an important role, such as taking Imodium 30 minutes before your meals could help slow down diarrhea more than if you took it after you ate. If gas is problematic, you want to avoid sugar alcohols. These are ingredients often added in sugar-free labeled foods, and they would be listed as sorbitol or mannitol on the ingredient list. They're often very problematic for people's digestive systems. You also want to avoid swallowing air. This would be avoided by avoiding carbonated beverages, drinking from straws, or chewing gum. After your treatment, the nutrition recommendations for survivorship are the same as those to prevent cancer. You want to strive for a healthy diet once treatment ends and the side effects have gotten better. So these recommendations include a plant-based diet. This doesn't mean that you have to be completely vegetarian, but it does mean that your diet has a lot of plant foods. These foods are much higher in fiber, antioxidants, and phytochemicals than more processed foods, and these properties help prevent cancer recurrence. Adequate protein is also very important. It helps to build, maintain, and repair muscle in the body. It also helps to keep fluid where it needs to be, and it helps maintain a strong immune system. Physical activity is very important. 30 minutes of low impact exercises per day are recommended. You could choose the ones that you enjoy the most, but moving your body is always going to be beneficial. And exercise has been shown to impact cancer mortality and recurrence rates with certain types of cancers. Maintaining a healthy body weight is also recommended. There are different formulas for men and women, but we want to avoid carrying excess weight. These recommendations are subject to change depending on your symptoms, whether they're present from your cancer treatment or lingering post-treatment. So it's always important to talk to your doctor or your own dietitian about a healthy weight range for yourself. Fruits and vegetables are certainly part of a healthy diet. You want to include 5 to 9 servings of them every day. Serving sizes would include half a cup of a cooked vegetable or a cup of a raw vegetable, a medium piece of fruit, such as an apple or a peach, about the size of a tennis ball, half of a cup of a cut up raw fruit like watermelon, or a quarter cup of dried fruit like raisins. Breads, grains, and cereals. You want to include 3 to 5 servings per day of these foods. Ideally, you want to choose them as mostly whole grains. These would be oats, barley, bulgur, brown rice, quinoa, or farro. That's because these are higher in fiber content and in phytochemicals and antioxidants compared to refined grains. These beneficial properties are stripped away in the refining process. Serving sizes of these foods would be half of a cup of a cooked grain, 1 cup of a ready-to-eat cereal, or 1 slice of bread. With protein, you want to include 2 to 3 servings per day. You also want to space them out throughout the day for the best absorption of these. You want to focus mostly on seafood and poultry, and the guidelines recommend including 3 to 4 ounces of fish 2 or 3 times per week, and a serving size is 3 to 4 ounces. Beans, legumes, nuts, and seeds are wonderful sources of plant protein, and the serving sizes of those are a quarter cup of a cooked bean, a tablespoon of peanut butter, or half an ounce of nuts or seeds. The size of a deck of cards is about 3 to 4 ounces, so that's a good visual guideline for a proper portion. You want to limit your intake of red meat to less than 18 ounces per week. Red meats include beef, pork, lamb, or goat, and you want to avoid processed meats such as hot dogs, bacon, sausage, salami, bologna, or ham. For dairy, you want to include 2 to 3 servings per day and choose lower fat options such as skim or 1% milk, lower non-fat yogurt, part skim mozzarella, or low-fat cottage cheese. If you're going to use a dairy alternative, you want to make sure that it is fortified with calcium and vitamin D. A serving size is a cup of milk, yogurt, or dairy substitute, 2 ounces of cheese, or half a cup of cottage cheese. When it comes to fats, Omega-3 fatty acids are essential in the diet because the body does not produce them. Omega-3 fatty acids help to reduce inflammation, and salmon, mackerel, sardines, herring, oysters, anchovies, flaxseed meal, chia seeds, and walnuts are all examples of foods that contain omega-3 fatty acids. Overall, you also want to choose unsaturated fats and limit saturated fats. Saturated fats are the solid meat fats or butter or cream. Because we don't always have measuring cups around all the time, I wanted to include a visual portion size guideline. So your hand is always going to be a good tool for estimating portions because the front of your closed fist is about half a cup. A clenched fist is about 1 cup. The tip of your finger is about a teaspoon. Your thumb is about 2 tablespoons. And your palm is about 3 to 4 ounces, which is the standard serving of poultry or meat. Another easy visual guide is the My Plate method, where you want to fill half of your plate with non-starchy vegetables, a quarter of your plate with a lean protein, and the last quarter of your plate with a high fiber starch or whole grain. Thank you very much, and I look forward to answering your questions during our Q&A session.